Hello, I am Dr. Neha Gupta. I am a gynecologist and obstetrician practicing in Gurgaon, and today I am going to talk to you about fibroids. Fibroids are a very common occurrence. So many of you, when you go to get your ultrasound done, there is incidentally a finding which comes up as a fibroid in the uterus. And many a times women with bleeding problems do come to us and they are eventually diagnosed to have a fibroid. So what are fibroids? Fibroids are basically growths from the muscle layer of the wall of the uterus. बच्चेदानी में जो मसल की लेयर होती है उसमें जो रसौली बन जाती है उसको फाइब्रॉइड कहते हैं. सो दीज फाइब्रॉइड्स आर बिनाइन ग्रोथ्स, दे आर बिनाइन ट्यूमर्स, यानी कि ये नॉन कैंसरस होते हैं इन 99.9% ऑफ द केसेस. Fibroids are very common, usually in women who are in 30s or 40s years of their age. Fibroids are seen in about 60% of women. But not all fibroids need treatment. So many of them are just diagnosed incidentally on an ultrasound scan. If they are small in size and if they're not giving you any trouble, then we do not need to treat them. Fibroids can be single, they can be multiple in number, they vary in their position, in their shape, in their size. They can be located within the wall of the uterus, or they can start projecting inside the cavity of the uterus, or they can start growing outwards. Sometimes with a thin pedicle, with a thin strand of tissue, they may be just attached to the uterus and keep hanging, something which we call as the pedunculated fibroid. So what are the symptoms or the problems caused by these fibroids? As I have already said in the earlier video, not always do the fibroids give trouble, but when they do, then the most common trouble that they cause is problem with the periods. In the presence of the fibroids, the periods can become irregular, they can become heavy, they can become very painful as well. The other problem that the fibroids can cause are the pressure symptoms. If the fibroids are very large, then they start exerting pressure. If the fibroid is in the front wall of the uterus, then it starts putting a pressure on the urinary passage in front, leading to frequent urination, incomplete evacuation of the bladder, and it may even lead to complete urinary retention. If the fibroid is growing towards the back of the uterus, and which means that if it is towards the spine of the lady, then it could give rise to lower backache, it could give rise to constipation and difficulty in passing motion. If the fibroid is very huge in size, it can give a bulge in the tummy, it can cause a pressure in the lower part of the tummy as well. Sometimes the fibroids can even lead to problems with fertility. This is particularly the case if the fibroid is projecting inside the cavity of the uterus. It can lead to repeated pregnancy losses, that is, it can lead to miscarriages, and it can also lead to a difficulty in getting pregnant. Rarely, very rarely, a single fibroid, huge fibroid which is rapidly increasing in size, particularly in older women, the ones who are nearing their menopause or those who have attained their menopause. Such fibroids rarely can even harbor a malignancy, that is a cancer. So when do we treat fibroids and what are the options available for treatment? Fibroids which are small, which are picked up incidentally, which are not giving any trouble, do not need any treatment, but they can be kept on a follow-up to see for any increase in their size by doing annual ultrasounds. But if the fibroid is causing a problem, if it is causing a problem with the periods, if it is large in size, if they are multiple, if it is giving rise to problems with fertility or pregnancy, then definitely they need to be treated. What are the treatment options with us? So the options are both medical as well as surgical. What treatment we choose depends upon the number of fibroids, the size, their location, and what are the symptoms that it is giving rise to, and what reproductive choice the lady has, whether she has completed her childbearing or yet the family needs to be completed. When we talk about the medical management, we have medicines with us, those which can be given by mouth. Also some injections are available that can be administered. All these medicines have their own side effect profile and their own risk benefit ratios. Medicines, they do cause a reduction in the size of the fibroid, and they take care of the heavy bleeding that was being caused by the fibroid. But once we stop the medicine, the fibroids usually start growing again, and later on the person may need a surgical intervention. So medicines help in treating the fibroids, but that may not be the permanent or the final solution. When we talk about the surgical options, so the surgical options can be just removing the fibroid and not the uterus. This is the operation which we call as myomectomy. If a lady has yet to complete her family, then we just remove the fibroid. Most of the times this operation can be accomplished laparoscopically, which means it can be done through a keyhole surgery, wherein we give very tiny cuts on the tummy, and using telescopic instruments we remove the fibroid. Sometimes if the fibroid is such that it is coming in the cavity of the uterus, then it can be removed with a modality which is known as hysteroscopy. This is a modality which is done through the vagina by using a telescope-like instrument on which a camera is attached. So we go through the vagina and we remove the fibroid from the cavity of the uterus without giving any cut on the tummy. But if the fibroids are multiple, if they are very large in size, if the lady has completed her family, say she is in her late 40s, or if the lady is already postmenopausal, then in those cases a definitive surgery in the form of removal of the uterus is the preferred option. When we remove only the fibroids and not the uterus, one must remember that later on there can be growth of new fibroids in the uterus. If once there is a tendency to form fibroids, then even after fibroid removal, later on new fibroids can come up, and this can happen in as many as 20 to 25% of the women. There's also a third option for the management of fibroids. If somebody is not very keen on going ahead with the surgery or is unfit to undergo surgery, then in those cases there is a procedure wherein small particles, the particles which are of the size of a sand grain, they can be injected into the artery and the blood supply to the fibroid can be cut off. This process is known as uterine artery embolization. This is a non-surgical procedure which is usually done by an interventional radiologist as a daycare procedure, which means that admission may not be required, or at the most post-procedure 1 day stay in the hospital may be required. The blood supply to the fibroid gets cut off, and then with the passage of time the fibroid starts shrinking in size, and there's also a control of the heavy bleeding which was associated with the fibroid. This procedure is generally preferred to be done in those women who have completed their family, and we have to be very sure that there is no cancer of the uterus before we go ahead and do this procedure. So there are various treatment modalities available for the management of fibroids. There is no one method fits all approach whenever we are treating fibroids. We really have to individualize what treatment modality will be the best for any particular patient.